So much of what we rely on has fallen away. Everything about life has become more challenging and difficult. We've all had to make sure that we're looking out for each other, not leaving people behind.
Adult female code red.
Head-on collision, 80 miles an hour.
Hit and run, cardiac arrest.
I can't feel a pulse. Start chest compressions. Mark. Check patient. Mark.
We have a pulse. How'd you like your tea? 2 sugars. 2 sugars.
St George's, London.
Doing really, really well.
One of Britain's busiest A&E departments.
Are you able to come now? CT is ready for us.
It's gone mental in here.
Officially full in resus.
Who's the most famous person you've met?
Sinatra.
Really?
It's fun.
A place where life,
I just love doctors.
love,
I'm a lucky girl to have you.
and loss
Just say goodbye to your family, OK?
unfold every single day.
In A&E, whether it's patients or the people that I work with, I see ordinary people doing extraordinary things.
Well done.
Thank you. Thank you very much.
Filmed across one 24-hour period, these are the stories of a nation and its health service.
So sorry.
Why are you sorry? This is literally the reason we're here.
When faced with pain, when faced with hurt, people's innate desire is to stand by one another.
I miss you. I'm worried I'll never see you again.
Oh, sweetheart.
Time and time again, day after day, people choose to love.
You're in safe hands. You're all good. All right, darling?
So they're deep cleaning, so they've had 2 positives, so they're deep cleaning the ward.
So we put them in one,
And
and that'll be furthest away from
everyone.
There's a chest infection in 9-year-old coming in to be arriving in the next couple of minutes as well.
Do we know about a transfer?
Huh?
A transfer coming across?
Another one?
It's all going a bit mad again.
I'm so tired, it's unbelievable. April seems like a really long time ago now.
Got to June and you were like, where's the beginning of the year gone?
I feel like I blanked half of it out. I just remember being here a lot.
Yeah.
In the beginning of the pandemic, I actually was feeling pretty disheartened at everything that was going on. A lot of people in the NHS were quite worn out. I personally was.
We're looking after him. He's in good hands. I'm sorry it's a bit unexpected, and I'm really sorry that's really bad news. Yeah, we'll keep you posted.
With work being bad, the idea of being so far from my family and my support bubble in Glasgow, that in itself was very difficult.
I'm going to be honest with you. It's not very nice, this swab.
What is it like?
I have to go into the back of your mouth. I know. And then up your nostrils.
We have a responsibility to the public to do the best we can regardless of the situation, but it has become quite challenging, and even more than ever, we have had to find new ways of being able to relax and de-stress.
On that note...
Can we go home?
Are you okay?
Yeah.
Good man. Cycling was a massive lifeline for me. It was a way that I could get a release from everything else that was going on. I remember the first NHS clap. I remember I was out on my bike and I was cycling down through Westminster, and I remember cycling across the bridge, but as I turned the corner onto Embankment, it turned 8 o'clock. All of a sudden, all the boats started tooting and the lights started flashing and everyone started cheering. People hanging out their window with pots and pans. I remember my phone buzzing in my pocket as all my friends started texting me, being like, the shards turned blue for you. It made all the hair stand up on my arm. It gave me this warm feeling. Everybody was just giving us a little bit of encouragement and appreciating that we were working as hard as we could. And it put a massive smile on my face. It meant a huge amount. It still does.
Hello, Risa, St. George's. Okay. Are you coming by land or air? Head injury, chest injury, thoracic back pain, yeah. I'll see you shortly.
What is it?
So, motorcyclist, car versus bike, head injury, chest injuries, but complaining with thoracic back pain.
If it's mentioned that there's a road traffic collision, that makes me a little bit more anxious. It makes me remember when I ended up in resus on a trolley.
So they already gave 1 gram of TXA,
He's already had 1 gram TXA.
1 gram paracetamol and onacetron.
I was cycling through South London along one of the roads that I cycle along daily. Before I know it, I'm in an accident with a car.
All right, we're here. Oh, that's pretty bad. All right, ready, get your team. Action.
Anesthetics here, ODP here, orthopedics here.
I can't remember a sequence of events. I just have flashes in my head of seeing a lot of worried faces. Your head and neck are immobilized, and all you can see is the roof.
Right, keep your head nice and still, OK? We're just going to be working round you. Can get you off the scoot.
You hear a lot of voices, it's very busy, but a lot of people you can't see because you can't look around. People are kind of attacking you from all angles. It's an intimidating experience. I think it runs through my head a bit more now that I've been through it. On the other side, I can now relate how it must feel to be a patient.
Bring back memories.
Yeah, I'm getting flashbacks here. Okay, watch the blocks.
Ready for handover?
Yes.
So, good afternoon. This is Josh. He is 28. He's been the rider of a dirt bike. He's lost control of his bike. It seems as though the bike has gone through a hedge. He's come off and then landed on his right-hand side. He's got what appears to be a closed frontal head injury. He's been complaining of right anterolateral chest wall pain with associated thoracolumbar back pain.
Excellent, thank you. Okay, Grant, primary survey?
Yeah. Can you take a big deep breath for me? Any pain when you do that? In your back, it's sore. So he's got bilateral anterior chest wall tenderness. Sorry, Josh.
My back.
It's your back that's hurting.
You're happy to take him CT?
Yeah. Lying there, he also realised that you don't really know what's happened to you. And it was very, very scary, not knowing the extent of your injuries.
Do you know if anyone's contacted any family or friends?
Maybe my missus has been contacted.
When you go out on your bike, you're so exposed and often travelling at such high speed that you don't think about the risk.
Ready, steady, slide.
You can have spinal injuries, you can have pelvic injuries, neck injuries. Worst case scenario, they could end up in a wheelchair. There definitely is the possibility that the patient might not be able to walk again. Oh, interesting.
27-year-old Josh is in A&E after being thrown from his motorbike at speed. Doctors are concerned that he may have suffered injuries to his head and spine. His partner Sandy is still travelling to St George's.
For anyone that has a partner who rides a bike, their biggest fears when they leave that house is, are you going to come back okay? He's loved it from a child. He's always grown up around bikes. All the kids were into bikes as well and mopeds. He was a little mischief child. Dennis the Menace, I suppose.
I'll get you some painkillers as soon as we're back, okay? Where is it sore? Still your back?
Josh and I have been together a year and 8 months. I remember the first time being on the bike with him. He picked me up. He gave me all his bike gear, his trousers, his jacket, his helmets, his gloves, and we went for a little ride. I'll never forget, it was dark, rainy, and I remember he'd done a wheelie with me on the back of the bike. I enjoyed it, I liked it. The thrill of speeding, being able to do stunts on the bike. I do get it.
So it's all stable?
I'll ask the consultant to come and speak to you.
Hey, Joshua, how you doing? Have you spoken to your girlfriend? No. I need some painkillers first.
Okay.
No.
Do you want to wait until we get an update on what they've seen?
Yeah, I don't know.
Okay. I don't want to worry your missus. I don't want to cause you any upset either, okay? Oh, we've got a phone call. 1 second. That's Sandy. Do you want to speak to her?
Yes, please.
Hold it over your head.
Yeah.
Hi there. Hi, Sandy. Sorry, please. How are you?
I've just arrived at St. George's.
Right. Because of COVID, you may not be able to come in, okay? I'll just put you on speaker so you can talk to him, okay?
You're babe. Yeah. Yeah, my back hurts. Just try and get in there if you can.
Even though he was into crazy stuff, I felt a lot of protection by him. Like, he cared a lot.
Once they know more, they'll give you a full update. All right, okay. Speak to you later. Bye.
All my family's back home in Lebanon. Josh grew up on an estate in Hanwell. He's grown up with all his cousins and his aunties and uncles and grandparents, so he knows what it's like to have a big family and to have stability around you. I always thought that it's important to have a big family, and I think I've always been trying to look for that in this country. He gave me that.
Doctors are concerned that Josh's CT scans may reveal life-changing injuries.
Where's the... Oh, here we go. This is what I'm after. There we go.
Oh!
This must be... Ish. That ain't stable. And when you see a spinal injury, you definitely worry. We need to make sure that they're kept as still as possible because it can result very rapidly into something life-changing. That is nasty, look at that. I need the telephone.
I don't feel like this mask fits my face. These smell, these, don't they? I'm going to spray mine with perfume.
Phoenix.
Yeah,
Hello.
Hi.
I'm Daniel, I'm one of the doctors. Nice to meet you.
Hi.
And this is Phoenix.
Yeah.
Hi, Phoenix. I'm going to take down my mask just to show you who I am. Hi. You all right?
Yeah, he doesn't really
Come
like
on
masks.
in. Have a wee seat. So, you're mum, is that right?
Yeah.
OK, so tell me what's happened.
We were just getting ready to go out, and I saw him. He'd got to the toilet. He'd managed to get in and pull out like those toilet things.
Oh no!
And he was eating it.
Oh dear!
And then, but also, so I checked. So his face was pink and green.
Yeah.
And it stunk of lace. I've got it with me. And
So you turn your back for a second. So which bit of it did he have?
he's like,
Just this, the whole plastic bit?
yeah, he'd taken it off the loo.
OK. You're a climber, aren't you? He's a climber, isn't it?
Yes.
Yeah.
I called 111 like straight after, and they said because
Yes.
it's a limited edition,
Yeah.
like, toilet cleaner. But,
Lucky you. Getting the good stuff.
so they didn't know the ingredients.
How long do you think you had it for, roughly?
I think like a minute. So I'm trying to think. I just felt really panicky. It's
Don't worry.
yeah, it was
That's
just
fine.
it gone soapy like how it would in the loo.
Yeah.
When I had my first child, Ezra, I felt like jolted into this shock of motherhood. And I remember thinking, how can I do this? Like, the responsibility just seemed absolutely massive. You know, no one said I can do this. I've not been, like, interviewed. It's not a job interview. Like, can I do this?
And when you saw him, what was he doing with it? Chewing on the end?
sucking it.
Sucking on the end?
Yeah,
Okay.
because I think because it smells so nice.
Yeah. Understandable. Okay. And he managed to grab that himself. He's trying to do it again.
Phoenix just absolutely fixated on putting things into his mouth. I think that's how he's discovering things. It's almost like an animal, like this is new, I'll put it in my mouth.
Right, shall we have a look at him then?
Like one day when I was cooking dinner, I just turned around and he'd crawl out into the garden, just roll down the concrete steps, and he'd basically just eaten a snail. And he just didn't care, and he was crunching it, and it was so disgusting. All this drool is coming down. It was horrible. But he didn't seem to mind the taste or anything. Like, he would have happily swallowed it if I'd let him. It's only now I'm a mum, I've realised how much work it really is.
Have you given him anything to drink or eat after it?
No, I purposely didn't. That's because I didn't.
Yeah,
I
you didn't know what to do. That's
like, I might spray.
That's fine, don't worry. Let's have a wee look in his mouth. Sorry, Phoenix. He knows what game I'm playing here. Right. Come on, you little monster.
The bleach thing made me panic more because it's more like of an everyday thing that was on my watch. So it's like, oh my God, what else am I missing? Do you know what I mean? Like, what else am I missing? We're always asking yourself, oh God, am I guilty of doing the wrong thing? Again, I'm kind of always thinking, oh God, what if this happens? What if that happens? Because I've been there before.
He's so strong.
I'm sorry, Poppet, I'm sorry.
Very resilient chap. Right, excellent. So, there's a couple of things we need to do. First of all, we need to get a heart trace on him and just make sure that his heart's all right. We need to keep an eye on him. And I think what we'll do is we'll give you some water just to wash some down.
It does have bleach in it.
Most of these things do, so I don't know what's on the actual ingredients of the thing. Did it say that?
I don't even have a packet to throw it away.
Right, it's probably a corrosive.
It's not going to be like those batteries.
So they do similar things, these types of things, right?
Yeah.
The question with him is how much has he managed to actually swallow? So much like an acid, just extreme pHs can burn our mouths and our tummies, okay, if we're to swallow it.
Just didn't think he could get it where it was.
Listen, with someone this good at climbing, it's always going to be hard. You can only do what you can do. Kids get their hands on things. They do this. I as a child, did this as well.
Oh, just eating some crisps and now my breath smells in my mask. Hello, A&E reception. Now, I need you to clean your hands. Keep going until it's all rubbed in. Keep going until it's all, like, evaporated off.
It's evaporated.
Okay.
He's got a T4, T5. I'll wait for the formal report.
Is that contusion as well, or?
He's got quite a lot of right-sided lung contusions.
It's difficult to tell, isn't it?
Being a patient makes you feel very vulnerable. Give me a min. I needed quite a lot of assistance. It was astonishing to see how many people stepped up, how many messages I got offering help, offering support. It was quite touching.
Have you been well, man?
Yeah, I'm all right, actually.
Scar's looking amazing.
It's still quite swollen and it's still quite numb. The sensation is coming back. I thought it wouldn't come back at all, but it definitely is coming back a bit.
You still dribbling?
A little bit.
No more than usual.
Yeah, no, exactly. Yeah, I was in theatre for 5 hours.
Oh my God.
Because that was all full thickness. Didn't realise that was all full thickness as well. That was manky, and this was like literally you could feel my face back. So I was like, it was horrible. I can stick my tongue through a tin. After my accident, it was extremely frustrating having to stay at home and feeling a bit helpless. We are in the middle of a pandemic and there are staff shortages. All I wanted to do was get back to work. And this is what I do, this is what I train for. And I wasn't able to stand up and help at a time of need. Right, I'll go and see if they need anything next door.
Okay. It hurts to breathe. It's getting worse.
I know.
This gas is not working on the arm.
Because you're talking, you need to keep on using it.
I know it's because I'm talking, but I don't think it's going to work regardless.
Well, let's just try.
What is up with this? What is this drug? What's it called?
Hemfrox. All right.
It's so tricky.
In and out, in and out.
Ross is in resus after dislocating his shoulder for the 3rd time.
Can I ask you a question?
You can ask us a question.
I don't think it's like racist or something. Why are so many nurses Irish?
Because we've got a big shortage, so we need them to come over. So we need our Irish friends to help with.
Oh,
yeah.
when you said we, I thought you meant Irish people. I was like, why would you leave then?
No.
I was confused why my hand looked blue.
No, I'm not.
But I'm wearing gloves.
Yeah.
I was working at my part-time job in the pub at Wetherspoons, and at the end of the night, we have to clean the alcohols, like wipe them down. As I pulled away this trolley, I started wiping, and I sort of flew towards it, and my arm just popped up. It was like, I can't believe this has happened again. I just instantly knew my arm's dislocated. Someone called an ambulance, and so I shouted out, and no one believed me. Everyone thought I was playing games. They thought I was on the floor like messing about.
My right arm. Right, would you like some morphine now?
Yes, please.
Yeah. Do you have any allergies to any medications?
No, don't, just go for it.
Just go for it, okay.
In and out.
All right, Ross, sharp touch.
Are you a fan of watching it?
Go for it.
It's like this deep pain inside the socket. It's like an unreal experience, and you live like every second, and you turn into like almost a different human being.
Do you get a warm feeling up your arm shortly?
How does the morphine work?
I don't know, you tell me, I've given it to
It
you.
doesn't feel like it because it's in intense pain still. It doesn't feel like
Keep
anything.
sucking on that Penthrox.
Dislocated shoulder can be incredibly painful. The shoulder, when it comes out of its joint, gets caught behind some of the muscles and ligaments in the shoulder, and every time you then subsequently try and move, that causes lots of pain.
It can barely move.
That's why we're going to fix it, okay?
Please, doctor.
We're going to put it in, buddy, all right?
I need more.
Can you lift this arm slightly for me, mate?
It hurts.
Another 5 milligrams of morphine going in now, okay?
All right, mate, this is Tom. He's another one of the doctors as well, OK? He's going to give me a hand putting this back in.
Just go full throttle.
I'm going to leave you with the 3 lads, all
I
right?
think you can move slightly over here, buddy. Whilst we're doing this, you just breathe in and out as much as you can, OK? Mixed with the morphine, that should be quite good. Slightly up, Tom, that's it. Externally rotate it slightly, Tom.
All right, Ross, keep breathing.
Keep breathing on the Penthrox, Ross.
Oh, go on, Tom.
Go on, Tom.
It's not working.
In emergency department, we're quite to the point and like to get things done.
Ross.
All right.
But sometimes we need to recognise in ourselves when things aren't working and be flexible with how we deal with those patients. And at that moment in time, I think the only thing to do is to stop and reassess and reset.
I'm sorry.
No, it's not your fault, mate. It's not your fault. Like, it's painful, and I think you're a bit understandably anxious about it going back in again.
It's the worst it's ever been.
We'll have to come up with another plan, all right?
Jack, I made call me yesterday. I went shopping and I had to buy some mild curry powder. Came home, made it, and I thought, it doesn't taste much of curry. It was really spicy. I didn't buy curry powder, I bought chilli powder. I put 4 tablespoons of chilli.
Hello?
Hello.
You ready?
I was born ready.
Yeah, man. Yes, sir.
Hi, it's Martin. That guy's CT's back. It looks pretty bad.
Registrar Martin has been reviewing the initial CT scans of Josh's spine.
Yeah, I'm doing it right now. All right, bye. Josh, I've had a look at the scan, OK? We're still waiting for the formal report, but it looks like you've got a fracture to one of your vertebrae in your spine, OK? And that's what's giving you the pain. You've also got some pretty nasty bruising to your right lung. You're obviously going to need to stay in with us for a little while, okay? We'll need to see if you need any treatment for that spine. It looks pretty unstable, so we'll need to keep you flat for the entire time, all right?
Josh's partner Sandy has yet to be informed of the extent of his injuries.
I've got your partner just sat outside.
Yeah.
Do you want me to bring her in?
Yeah, please.
Yeah? Hi there. Are you Joshua's partner? Would you like to come through and sit with him? Yeah? He's just up here. I'll bring you through. We're waiting on the full report from his CT scans. Have a seat. Joshua, there's your fan club.
Yeah, baby. What happened?
Doesn't matter. Can I kiss you?
Stop saying sorry, just be okay. Just get out of the hospital first.
Gonna learn your lesson after this one.
He has to. It's not now until the baby's here. No bike.
Baby?
I'm 12 weeks today.
Oh my God, congratulations.
He wants a boy. For bikes, obviously.
Is it your first?
Yeah.
Your priorities will definitely change.
That's...
They should change, all
Yeah.
right? You've got someone else to worry about.
Exactly.
I just turned 12 weeks that day. I just hit my 3-month mark. I thought he might appreciate how dangerous it is riding bikes now that he's got a family coming. He has a lot of older friends that have families and kids. And they've said to him that once you have a family, your whole mentality changes. Because the baby wasn't here yet, it's just a bit like, oh yeah, you're pregnant. I forgot you're pregnant. Being pregnant in a pandemic is awful. First scan I had in the NHS, he did come, but he had to wait outside the hospital. So it's only me experiencing it alone. It's meant to bond the dad with the baby, you know, but he's just left out of it. I feel it more than he does. So the idea of him having a baby, obviously it hasn't hit him yet.
Hi, we're the neurosurgical team. Can I talk to you about what's happened?
Yeah.
So you had a nasty fracture. Okay. And if we leave it, you will do damage to the nerves of the spine. That can leave you paralyzed. The way to fix this is to actually put screws and rods in the spine. Okay? And the risks of the procedure is damage to the nerves, the spinal cord. But that's serious. It can cause paralysis.
I just thought, with the baby on the way, this is probably the worst thing that can happen. Instead of it being celebrations, it was worries. He can be paralyzed to the point he can't even maybe lift up his own child.
Oh my God. Are they usually this hard to get back in?
Yeah, usually. How's the pain?
It hurts.
It hurts?
Yeah.
We're going to try a slightly different way, OK?
Doctors are now on their second attempt at realigning Ross's shoulder.
It should go back in quite normal. He's just really anxious.
People get apprehensive that it's going to hurt. So if they're not relaxed, then it will never go back in. So he's just like...
Yeah, you can see it.
Yeah, so unless you can talk him out of it, you've got no chance, really. I'm probably the least relaxing person to be around.
I rush around the place, I try and get things done. Just ask my wife, she would probably back that up. When my wife told me that she was pregnant and I was driving, and as usual, I was probably driving a little bit faster than I ought to. She said I had to drive carefully because there was precious cargo on board. And I was like, yeah, whatever. And she said, no, precious cargo. It sort of did trigger that perhaps I need to get a bit slower and go a bit calmer and just adapt your own approach to how you would normally do things. So I tried to remember to do this at work as well.
Sit up as much as you can. Tom, if you just support his shoulder.
Hi, my name's Richard.
I need more morphine.
So listen for 2 secs. The morphine is a good painkiller, but what we need to do is get the muscles to relax. You're going to put this in your mouth. Imagine you're scuba diving, and that's the only thing you can breathe through, OK? I want you to just breathe on that, and it's really key. This is going to go really slowly. Nothing's going to happen quickly. You're just going to breathe, OK?
The drugs that we can give, obviously, are effective painkillers. I don't think that the only way to make people pain-free completely is through giving drugs, though. People know things hurt, and it builds up in people's minds. So to overcome that stress and that tension, we need to understand our patients on a human level as much as we do on a medical and physiological level.
Try and relax and let your body relax, OK? So this muscle on the other side is really tense. That muscle just needs to relax, OK? It's the fear of it hurting. You're going to be OK. You see, that's as bad as it gets. This muscle here just needs to relax. I'm just going to gently massage it, OK? You just take slower, deeper breaths. No, deeper breaths. You might feel things spasming as the muscles start to relax. Just close your eyes. Big breath for me in. Big breath out. Big breath in. Big breath in. Big breath in. OK.
All right, easy.
Ketamine?
Propofol.
Propofol. Just Propofol?
I think so.
OK, fine. I'll bring over my computer.
Just
And a bag of soda.
too anxious, isn't he? Feels a bit unnecessary to keep pulling on it if someone's like... Yeah, exactly.
Hiya. Yeah, they said, like, they're just keeping him in for just to check. I don't know, I feel a bit sick. Yeah, hang on, I better go, hang on, sorry.
I was just bringing
No, I was just updating my husband because he's, like, getting worried.
They're beautiful. Hey. Look at those eyes, they're so beautiful.
Oh, thank you.
Hey, you're gorgeous, aren't you?
Doctors need to take a tracing of Phoenix's heart after he was found sucking a bleach tablet.
What you've been doing frightening Mummy?
I know. I swear, you have been worrying, Mummy.
Before I had a child, I didn't really think past the small baby stage. I don't know if that's a survival technique, but when I thought about motherhood, I think I definitely thought of just holding a little baby in my arms. But when something does go wrong, when it happens, it's like your true fears are realised. It's almost like, well, you were always worried about that, but you didn't actually think it would happen.
Let's put the water in your milk.
When I was around 6 months pregnant with Phoenix's older brother, Ezra, was in a car accident. I definitely felt really guilty because I wasn't with him. My friend and colleague drove me just because I just was in I felt like my legs were buckling. I could not have driven the 10 miles there. My emotions were so heightened and I couldn't, calm down my heartbeat. And I was also thinking, I've got a baby inside me. I could kind of feel Phoenix kicking loads and I kept trying to calm myself down. On my way to hospital, my biggest fear was that something irreversible had happened.
Oh, yeah,
I know what we'll do is ECG.
Okay, okay. Where should I put it then?
Pop on here.
It's the constant guilt of thinking about these choices you make. They're your lowest moments because all you want to do is make everything okay for your children.
So what is this checking? Just his...
The rhythm his heart makes.
Ezra had hit his head on the windscreen. They didn't know if he had hurt his kind of spine or not because he was in a curled up position. And they said to us that they needed him to put his legs down, but they didn't want to push them. But he kept saying he couldn't move his legs. He had a neck brace on. He was just crying. He was absolutely distraught. He was terrified and he was calling out for me. All I wanted in that moment was to hold him. Just wanting to kind of just get him so tight in my arms and try and make everything better that way. As a mother, all you want to do is protect your children. So you're always kind of like feeling this, God, am I guilty of doing the wrong thing?
It's looking a little bit wibbly.
Sucking on a toilet block. Mum says she thinks there was someone in his mouth. She put her finger in, but she's not sure. It says it's a highly toxic substance. It isn't as simple as it usually is with this one, unfortunately.
It's all right, I'll do it.
Oh, thank you, Dr. Dickey.
Just coming up with a funny name for myself. What's Martin's one?
Mac Tar.
I didn't get the Martin McTar.
Because I'm a fan of Tarmac.
Yeah.
Oh, yes.
Well, it was originally going to be like Martin, friend of Tarmac, which was a little bit wordy, and I thought, actually, no, we can reflect his Scottish heritage in this.
It's good to have friends like you guys.
Hello, how's little Phoenix doing?
Yeah, he's good.
Is he?
Yeah, he just...
Do you have something to eat?
Yeah, he has, yeah.
And he's kept it down?
Yeah, well, yeah.
Yeah? No vomiting at all?
No, nothing.
We never know how much they've eaten because they can't tell us, so we don't know if they swallowed it, we don't know how much has gone down, right? But the main thing is, if he's had it in his mouth, it's probably not very much that's been swallowed.
Yeah.
He's not vomited, he looks very comfortable, his observations have been fine.
Yeah.
ECG's fine.
Sorry, I feel like I've wasted everyone's time.
No, honestly, you haven't wasted your time. There is no one that would have said, don't come here, all right? There is no route for that.
I'm just so worried. I've got such
You
a
never
paranoia
know.
about
So the thing with kids is, we see this all the time. It doesn't mean that you should have been able to prevent it. It's not always possible to prevent these things. You can't watch them all the time. Kids do crazy things. I would settle your mind at this point and go home and just have a bit of a rest.
Yeah, just, I never thought about it. All the bottles are, out of reach, and this stupid...
You wouldn't normally think about the toilet bowl, to be fair. So we'll let you off on that one. And
so
no problem
much.
at all. I
Thank
hope
you.
you get home and have a relaxing evening.
Yeah, thank
okay?
you so much. Yep, thank you.
The realisation that I can't control their lives, I can't be there all the time. I've had to learn how to deal with that. I think everyone's going to make mistakes, and I think you just have to hope that the mistakes you make won't be big ones.
Oh, I'm just so excited about not getting up at 6 o'clock in the morning.
Definitely don't have a kid.
Yeah.
And now it's just normal. It's like, it's fine. But like, I don't feel like I've ever had a chance to stop and process anything.
Yeah.
I feel like, okay, like, pregnant, baby. And then, it's just like... Becoming a dad, it's partly a trial and error, getting the feeding right, getting nappies right, understanding when she was ready for sleep. We've had to adapt on a daily basis. Learning to respond to those needs when things aren't going smoothly is something I've become better at doing since becoming a dad. In many ways there are parallels in the sense that with a patient, I recognise certain circumstances require that approach.
So Ross, I think we're going to go for plan B. So what we might have to do is just give you some medication to put you into a very, very light sleep.
Okay.
All right, so we're going to do that, okay?
Propofol will just make him super floppy. I don't mind to
Yeah, but it's sedated.
Yeah.
All
I'll let you
vice
crack on.
versa.
I don't care. I can sedate if you want to just...
Carry on.
You guys do it.
Cool.
Happy days.
When he's more relaxed, you have another go. Yeah.
It hurts, eh?
Yeah, I wish it just never happened.
You'll be all right, don't worry.
OK, we're just going to hook you up to all the monitoring that we need to do. OK.
OK, so is everyone happy?
I'm happy. If you're
Are you happy, Ross? No, I know. You will be when you wake back up again. Just give him 50 to start off with. So just keep breathing. Just think about deep breaths. Feel your chest rise. Feel your eyelids get a bit heavier. How you feeling?
A little bit more.
A little bit more relaxed.
A little bit more, yeah.
Yeah, OK.
I hope this works, I really do.
It will, man. Don't worry. Another 25.
Can you close your eyes for me? Just take 2 big breaths in and out. Yeah, big breath. Yeah, with the oxygen. And keep your eyes closed. That's it. Well done.
I mean, you're nearly there, but 200. You just need to relax with me. You can hold my hands. Just gonna rest your head back, and you're just gonna relax, OK? There we go. You're just gonna feel this muscle relaxing here, OK? Tom, just gently lean back. I'll just keep your back straight and put your arms and just gently start leaning back. Slow traction. Just gentle increases, not sudden. You're good there, man. Nice deep breaths. Hang on.
It's gone?
Yeah, it feels back. How's that feel?
Feels back.
Feels like it.
Yeah, it does actually feel back in. Yeah. Yeah.
Christ, 225.
Huh?
Like, yeah, you took the propofol like a champ. Stonking this.
Yeah.
Do you feel like you've got some range of movement back that you didn't before?
Don't move it too much because we don't want it to come back out again. Can we get a sling?
You guys are really great. Especially like overweight recently. I do feel sorry for you guys.
Is it?
Great job. There you go. Celebrate with some propofol.
Yeah.
Babe, you still there?
Yeah.
Sorry, babe.
Don't worry about me. We'll get your bollocking when you get home.
We just need to pop a collar onto you, then we can get these blocks off of you.
Doctors are preparing Josh for emergency surgery to stabilise his broken back.
The thought of having this responsibility of this baby, it's worrying. I don't know how ready we're going to be when he's here. I think until I've had him and he's there in my arms, that's when it will all dawn on me of what parenthood is actually like. To have his own family, to make it grow, I think has always been important to him. But he needs to realise can't make a child not have a dad. It's because it's a thrill of riding. So he has a lot to think about.
They're not going to let me go in, babe.
Well, they're not going to let you into the wards.
You just expect every day to happen as you plan it. But unfortunately, sometimes it doesn't happen that way.
Are you drinking lots of water?
I've had 3 bottles of juice.
You need water.
I think that I've learned from my accident. You need the support from other people to get you back on your feet. And one thing I know from the last year is one of the most important responsibilities we have as people is to care for those around us. And that care comes back full circle.
Chili.
What's Phoenix taught you? He's definitely taught me not to have any bleach, any household products at any level, even if I think he can never reach it.
The specialist came round and told us if he doesn't have this operation, it can make him paralysed. It's like, oh God, that's just horrible. I couldn't imagine it. He might not be able to walk again.
People are always telling me that I've got to be careful. Things could have gone a lot differently. It could have been, I might not have been here. Obviously, I've got to be more responsible than what I was. I'm going to be a dad soon. I've got a family, so I've got to focus on that. I'm excited just for him to be born.
Mm-hmm.